This is Aaron Wallace, CEO of Balance Your Fitness, here with another great tip. Today we're going to talk about how we can avoid knee pain and how we can go and understand where knee pain comes from and how we can go and avoid it a little bit better. So I know a lot of people are walking around who are very active, runners, and play a lot of other different recreational sports. Our knees tend to be one of the joints that gets beat up the most. And I had a lot of complaints about how our knees have different types of knee pain. So I want to be able to understand a little bit about how the knee joint functions. So when we talk about the actual knee joint, the knee joint actually can go and have several different varied movements. So when we talk about the knee joint, we're just going to go ahead and just show a couple of different basic movements that the knee joint can do. So if I'm standing here, I'm just showing you the lateral portion of the knee. We have the basic movements of what we call flexion and extension. So flexion of the knee would be me bending the knee. So if I'm here doing a flexion of the knee, I'm taking it from an extended straight position and bringing it here. So that's called flexion of the knee. And then extension of the knee would be me extending the knee this way, so that way I'm straightening out the knee. And that's the first two basic movements. We can also go and actually do a little bit of rotation at the knee. When my knee bent, I'm standing here, if you guys can see this, is that a rotation in the knee where I can actually go and turn inward and outward, which actually also involves various movements at the hip and the ankle, which we're actually going to talk about in a little bit. So the knee is actually a joint that's actually highly affected by the ones above and the ones below. And I'm going to show you an example of this, is that our knee can be a bit of a slave to other joints, what's going on with other joints. So when we look at that, I'll give you an example, and I'm going to go ahead and just do this by arching my back or tilting my pelvis forward and tilting my pelvis back. So I'm going to show this from the side view, is if I arch my back and tilt my pelvis back, and then I tilt my pelvis forward, that's actually going to have an effect on my knee. So I'm going to show you what that looks like from the front. So if you watch my kneecaps here, so the kneecaps, again, should be lined up with the second toe when I'm just standing normally. However, if I were to go and posteriorly rotate my pelvis or tilt the pelvis forward like this, the knees will actually rotate and bend outward. Whereas if I arch my back, my knees will automatically extend and actually go and pronate or dive in. So people talk about their feet and knees always pronate. That's the position that you get when you arch your back, and your knees will extend back, so my knees will actually go and be more over my big toe versus actually having it over my second toe. So what do we want to be able to realize is that pain in our knee joints, or pain around the muscles of the knee or in the knee joint area, can be, and a lot of times is caused by something going on, usually either further up or further down. So when we talk about things that might happen, is that movements and changes at the pelvis will actually go and cause alterations of what's going on at the knee joint. So for example, if you are a person that wears high heels, I know a lot of women who wear high heels, and or other different lifts in the back of the shoe. Wearing a high heel will actually go and anteriorly rotate the pelvis, so it'll actually tip the pelvis forward, which will then place the knees into extension, which will then actually put our knees rotating inward or pronating. So this actually puts a lot of strain on the ligaments and other musculature around the joint, because it's actually not supposed to be in this pronated position all the time. So every time I would take a step forward, what would happen is that my knee would dive inward. Okay? So that way, again, I'm putting a lot of tension and stress on the medial structure of the knee, and that puts a lot of tension, can lead to a lot of wearing down the meniscus and cartilage in the knee over time. So that's very important. We're going to be able to go and understand. So it's not just if we go and arching our back or tilting our pelvis. We can actually also, people with any type of spinal issues where our back, our shoulders are twisted or one shoulder's higher than the other, will actually cause what's called a rotoscoliosis or rotational torque in our spine, which will actually torque our pelvis, where one half of our pelvis is more forward and one half of our pelvis is back. So this will actually cause more like a one-sided knee issue. Whereas, if someone was just wearing high heels, you may get actually pain in both knees. Whereas, one knee may be more in discomfort in another situation. So we want to be able to go and understand when we look at the knee joints and we go to our orthopedic surgeons or our chiropractors or physical therapists, whoever we're going to, is that we got to be able to understand that what's going on here is generally a slave to what's going on above the neck, so or above the knee joint. So we can't really go and start to make assumptions on, how can we go and what exercises to go and strengthen the quadriceps or hamstrings or whatever, unless we actually go and actually start to go and understand what's going on above that. So, and also, and we talk about also people with arthritic and rheumatoid arthritis and other arthritic conditions, and these that are actually driven by what's going on inside of our body with our immune system. So, for example, if we're eating a lot of foods that our body's intolerant to, so let's just say, gluten or pasteurized dairy, for example. This kind of revs up our immune system, making it work more than it has to. And a lot of times we can go and actually, through that process, kind of wear down and have our immune system kind of attack our joints. And this is the case with rheumatoid arthritis. And kind of going and breaking down a lot of the synovial fluid, or the actual fluid that helps to pad the joints. Where our immune system actually can go and attack those things if we're eating foods that we're intolerant to. So we want to be able to go and understand that the strength of our body with our core musculature will actually go and affect the strength of our body with in relation to avoiding pain in the knee joint. Now, each person is going to be different about what muscle is going to need to be stretched or exercised to be able to go and alleviate knee pain. So again, what works for one person may not work for another. That's why we want to be able to go and look at each person as an individual, and that each program and each exercise design is designed for that person, and what works for me may not work for someone else or work for the next person, etc. So you have to realize that, just some, random sheet of paper that you find online or at your physical therapist's office may not necessarily work, because you have to go and understand what's the mother of the cause, what's the root cause of what's going on at the knee joint, because it's generally not because of the knee, it's generally because of something else going on further up. So I hope that go and kind of stimulate your question, asking yourself some questions about why we're getting knee pain, and how we can be able to go and understand that our body's a system of systems, and pain at one site is generally going to be caused by something else that's going on higher up in the system. So I hope that gives you some more food for thought, and hopefully you can go and be able to go and ask more thoughtful questions for the professionals that you're working with, so that way you can go and take a more active approach in our recovery. And if you guys have any questions on anything we went through, you can always go and hit us up on Facebook or on YouTube, or you can send us an email at info@balanceyourfitness.com. I'd certainly be happy to answer any questions that you have regarding your own situation, so that way we can be able to help you heal a little bit faster. So again, this has been Aaron Wallace for Balance Your Fitness, asking you to live your life in balance.